Hello, my name is Angela. I will be your student nurse today. I'm here to do an assessment on your newborn baby. First, I am going to close the curtain to provide patient privacy, and then I will go wash my hands. Okay. Next, can you confirm your baby's name and date of birth? All right. Now I will get a birth history on the patient. I will check for the APGAR score. How far along was the mother when she went into labor? Was it a vaginal or C-section? Was there any trauma during the birth? Next, I will get vital signs. First, I will start off by getting the baby's respirations. I will place my hand over the baby's chest and count for a full minute for their respirations. During this, I will maintain patient safety and make sure that there is a blanket covering the baby to provide warmth. Next, I will check the axillary temperature underneath the armpit. Then I will auscultate the heart sounds and check the pulse by placing my stethoscope right between the nipples here. Also, I can check the apical heart rate for a full minute. Moving on, I will check the length, which I will check with a measuring tape from the top of the head to the tip of the toes, a weight by using the scale, a head circumference by measuring the largest part of the head, chest circumference by measuring at the nipple line. Then I will move on to bodily alignment. Is everything in line and symmetric? And I will check for muscle tone. Baby may be in a flexed position, and I will auscultate the cry. The cry is loud and audible. I will then move on to the skin, where vernix may be noted in the crest and folds. Mela may be noticed along the nose, which is white dots. Lanugo, which is fine hair, may be noted on the baby's skin. Arrhythmia, toxemia, which are red irregular blotches, could be noted. Mongolian spots, which definitely need to be noted. They are dark and purple and look like bruises. And petechiae, which are red dots on the face. All right, moving on to the head, I will palpate the fontanelles, the anterior and the posterior fontanelles. Make sure they are not sunken in. They are normal. Then I will check the baby's head for molding and check for the cephalic hematoma, which is a accumulation of blood, and caput, which is swelling that may cover the suture lines. Then I will move on to the face to make sure that the face is symmetric. Check the iris of the eyes, see the color, it's gray. Check for pearla, which may be sluggish and not light accommodating. Check for strabismus, which may be noted. Check and see if the conjunctiva is clear. Moving on to the ear, making sure the ear is aligned with the eye and that it is well formed. Check the nose patency and see if it's patent bilaterally. Mouth, I will stick my gloved finger into the baby's mouth, palpate the roof of the mouth to see if there are any openings. I could also check the suck and swallow reflex during this time. Then I will move on to the neck. Check and see that there are no openings. Move the baby's arms and check for crepitus. Then I will move on to the chest, checking chest shape and seeing if chest bilateral expansion is noted. Then I will check for nipple size and engorgement. Check breath sounds and make sure there are no adventitious breath sounds noted. check and make sure there is not a murmur noted, and check the apical pulse. Then I will check the umbilical cords for 2 arteries and 1 vein. I will auscultate the bowel sounds for active bowel sounds. Then I could also ask the family about the baby's elimination. How many wet diapers has the baby had today? Has the baby passed meconium, which is black tarry stools? And if so, how many diapers has the baby had with the meconium? Reflexes. Oh, genitals. I would check on females to see if the labia covers the clitoris and if there's bleeding. For males, I would check to see if the meatus is at the tip of the penis, and check and see if the testes are underneath the testicles and if rugae are noted on the testicles. For extremities, I will check for bilateral equal movement, check for muscle tone. Is the baby flaccid? Then I will check and count the fingers and toes. Then I will move the baby's hips, check for audible clicks, move the baby's arms and check for range of motion. And then I will also assess the baby's feet. Then I'll flip the babies over to check the vertebral alignment, make sure there is no openings, and check the patency of the anus. Putting back the baby's blanket on, I will check the reflexes. First will be the Mohr reflex. I will hold the arms down, let go, and this should trigger the startle reflex. Then I will do the tonic neck. The head should turn to one side. The side which the head turns to, it should be the closest to the body. The arm should be the closest to the body. Palmar, I will stick my fingers in the baby's hand and their fingers should grasp it. Plantar, I will stick my finger underneath the baby's toes and the baby should grasp it. Rooting, I will rub the side of the baby's face and the baby should turn its head towards my finger. Sucking and swallowing was noted earlier when I palpated the roof of the mouth. Stepping, I will sit the baby up and it will look as though the baby is walking. Bambinski reflex, I will rub the bottom of the feet and the toes will fan out. Trunk integration, I will rub the side of the spine and the baby will curve. Sorry, it's hard to do on a doll. They will curve. And lastly is behavioral. Is the baby sleeping in a deep sleep? Is it actively crying? Is it a loud cry? The baby is currently crying. This is my newborn assessment. Thank you.